If you've ever wondered how to keep yourself and your kids happy and healthy and strong for life, then this is the episode for you. Welcome to Move Better with a Cheer PT, where I'll be teaching you how to embrace movement, fitness, and a healthy lifestyle so you can keep up with your kids, reduce injuries, and have fun in all aspects of your life. I'm Laura Turner, a doctor of physical therapy, a certified functional strength coach, and a former cheerleader and coach. Thank you for listening. Now let's get on with the show. Hello and welcome back to Move Better. Today I have with me Dr. Herman Weiss. Hopefully I said that correctly, Dr. Weiss. Welcome to Move Better, and we're happy to have you with us. Today we're going to get into a lot of talk about more holistic approach to medicine and looking at the whole body. Holistic being not just throw medicine at a dysfunction. And so I'm really excited to talk with you, Dr. Weiss. I'm gonna tell you the two main things that triggered me to really want to, like, when we reached out and we talked to each other a little bit. One, your quote, you said, sunshine is the best medicine as far as fixing everything, or helping. Well, not everything, right. And that I fully agree with, and I there's been some discussion. I live in Massachusetts, and there was a pretty popular ball player that recommended nobody go outside ever, and the only time they go, and so because of the risk of melanoma, and that's a great cause, but the benefits of sunshine also are huge. So I really appreciated that. And the second, my mom was diagnosed with MS when I was born, and she quickly went off the traditional. She didn't feel good on the medication that they prescribed at the time, and went a more diet-based approach. And some of it's very controversial, and but her main goal in all of her life, and it's kept her. That was 55 years ago, so she's basically been pretty healthy and stable in the MS wise, like ups and downs, but because she's paid attention to her nutrition. And so I think that's those two things really hit home for me. So I'm excited to talk with you today. Tell me about your journey and how you got to this.
That's an amazing intro, and there's so many things I want to touch on, but I don't want to forget the sun thing, because I know when I get into a rhythm, I tend to forget things. I know we have a limited time, so I'll give you a quick background on myself. So I'm an OBGYN. I went to the Ohio State Medical School, College of Medicine, Buckeye, and went to Einstein residency program for women's health in the Bronx. Practiced bread and butter OBGYN in Long Island. Saw the practice of medicine kind of shifting, not going in the direction I really wanted to, and I wanted to instead of really expanding my horizon, so to speak. I got an MBA from George Washington University. Continued to see patients throughout my journey, so to speak, and mostly in women's health. And I saw that we were having to see more patients for less reimbursement, and having to have more stress, and not really connect with the patients that we wanted to. And a patient would walk in, you'd already be writing the script and giving it to them, and they're out the door, and the next patient. And so we still are, and to a certain degree, that's a problem. We're getting reimbursed based on how many patients you see, how many procedures you do, when really we should shift that, and the paradigm needs to shift to, are we encouraging a healthy lifestyle and whatnot? And unfortunately, and again, I don't want to have a soapbox here and start claiming that pharmaceutical companies are not good or whatnot. But I worked for a pharmaceutical company. I worked for Teva, and you mentioned your mother with MS, and Copaxone was like the big drug for Teva and for MS, and it helped patients live a healthier and better life. But the more we need to not only have medications when they're indicated, but also take every other aspect of life and really say, hey, our diet, our nutrition, and all these different, the microbiome that are pro-inflammatory versus anti-inflammatory. These things have been proven to be effective. The problem is no pharmaceutical companies doing these massive drug trials on those interventions to say, oh, here's some definitive proof that this will make you live better, when all you got to do is live better. So, and the proof is in the pudding, so to speak. So and it takes time. It takes a lot of time for patients to make those incremental changes to get to the goal. And I think we've sometimes, you lose the forest for the trees, and doctors are not the only ones to blame. Patients come in and they want a drug to treat this or a drug to treat that, and they don't want to put in the hard work, and it's hard work. So one of the things that, you have aha moments in life, right?
Yeah.
So one of my aha moments was, also when you're a physician or treating patients or seeing someone over and over, you kind of have a spiel, so to speak, of, oh, do this, da, 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 and then you're like, sometimes I don't even know I'm saying it, right?
Yeah.
So I happened to be, I was sitting at a wedding, and it happened to be, I'm part of a community here. So at this wedding, it was actually my wife's best friend's daughter's wedding, and I had a patient that was sitting next to me, a patient of mine, and we're cordial and whatnot. And she says, she told my wife, your husband saved my life, and again, I was just doing what I was doing, and it dawned on me, and I'm a little choked up about it, because I threw it out as just like a throwaway comment, and I said something like, oh, something, whatever it was, and it was like years ago, and I just, it was a throwaway comment, and I've been saying it over and over again to patients, and not realizing that patients actually listen and it has an effect. I said, wow, I wish my kids would listen to me like some of my patients. And she took it to heart and made changes in her life, and sure enough, her life did a 180, I would say 360, but did a 180, and she really made some really important decisions in her life, and it affected her for the long term. This was years ago. And so it got me to thinking that, my words are valuable, so to speak, or worthwhile. And I should really be very careful about what I say, for the good and for the bad. If I say something that, oh, you're never going to lose weight, or you're going to struggle, it's not helpful. So the positive commandment, positive, comment here or there can go a tremendous amount. So I started talking to my patients more about, healthy lifestyles and whatnot. And one of my, my pet projects is, my real life is now guided towards this, is polycystic ovary syndrome. I don't know how much you're aware of the, PCOS. It's, I would say, rampant. It is the most common, female endocrine disease, affecting, in some studies, up to 20% of females. I'm seeing a rising in the population. I'm seeing a higher incidence of the syndrome. I think it's because we have a more sedentary lifestyle, and we have a more our diets are going, the hell in a handbag. I'm sorry,
Yeah.
if I use a bad word, but it's
Yeah.
really, we're not doing ourselves any justice there, and any service. So, if you're aware of PCOS, basically patients can present with sometimes a very challenging diagnosis. Studies have shown that they did a study where they took a group of women, and they arbitrarily studied them, and sure enough, the incidence in that population was about 10 to 15%. But of that 10 to 15%, 77% didn't know they had the disease, which is dramatic. So patients say, oh, I have irregular bleeding, or I have some hair growth or acne, or I have difficulty losing weight, or, and then on sonogram, they had a lot of little follicles on their ovaries. And so it became patients go from doctor to doctor when they have these troubling, I wouldn't say diseases, but they have a lot of difficulty in their, reproductive health, or pre-diabetes, metabolic syndrome. And it sometimes can be a very challenging diagnosis. And so that's why these patients don't necessarily, whether they seek treatment or they seek treatment, sometimes they go to two to three doctors. Unfortunately, what's happening is that doctors will look at their blood work and say, oh, you don't have the blood work, that's suspicious for PCOS, so you don't have it. And that's probably the worst thing that a physician can do, because it paints them into oh, a doctor said I don't have the disease. And again, I tell this to my patients all the time. We live on a pendulum, right? and if you do the right things and you diet and exercise and have the right mental health, so to speak, and mental wellness, you're going to shift that. But if but even if you don't shift it, and if stress happens, because stress happens in life, and you're shifting back, but that's life. So maybe when they did the blood work, you were here. Blood work only tells me one thing: what the blood was when you do the test, not 10 minutes before and not 10 minutes after. And so you have to take everything in context. And so often is the case that doctors will say, you don't have PCOS, and be done with you. Here's birth control pills.
Right. Yep. Yeah. So because I don't know a lot about PCOS, and I I can speak from my experience. So I had troublesome menstruation throughout life. In the beginning, it was very painful, and I threw up every month. I praise my father because he came to pick me up from high school all the time. And then, it got better and normal, regular, until I hit perimenopause. I don't have children. I did get pregnant at 42 and miscarried. And I had probably for about 10 years prior to that, give or take, some irregular bleeding here and there. And, it's just kind of like, it is, you can, my mom doesn't know this, but, so hopefully she doesn't, well, whatever, she'll know now, but I was on the pill for a little while. Yeah, I was on the pill for a while, and then I didn't my period stopped, and I was like, this isn't normal. I shouldn't not happen altogether. So I didn't want to deal with the hormone stuff at all. And so I don't know if I had, I'm 6 years into menopause. They're finished, now. I guess my question there is, what, you said irregular bleeding and hair changes. Are there other symptoms that we as women should look for? To say that,
So first and foremost, infertility. Patients come in because they're not ovulating regularly. Changes in your menstrual cycle, too much bleeding, too little bleeding, or no bleeding at all. And when you go to your doctor, you need to talk about your history, like what's going on to get there. We talk about acne and hair loss, hair loss where you want your hair, and hair growth where you don't want it. And so, there's also oily skin in areas. There's these dark patches, and sometimes you get growths. Those are more advanced cases where patients, pretty much know. So those, and like you said, sometimes painful periods, sometimes, the hormonal fluctuations can be very, very dramatic, but very often they're just not ovulating, and that's causing all those bleeding abnormalities. But infertility is a big one, and that's a lot of times where the patients seek treatment. And what's interesting is that I often find patients in the same families, although we have not found a genetic component to this. I do see it from mothers to daughters and sisters. I have like 4 or 5 in the same family, and I tell the mom, bring them in, in their teenage years. Now, what I try to do is get involved early, so that what happens is that if they're not ovulating, the surface of their ovary, like the basically, I always tell this to my patients that I carry this around. I say, I hate, I don't want to make this too technical, but I talk about the normal menstrual cycle, and I talk about the ovary, and if you could see that the surface of the ovary becomes very filled with follicles. Sorry, that's the ovary. There's a lot of follicles, which is where the eggs are, and then they don't, and then eggs supposed to drop every month, and if it doesn't drop, the surface becomes very thick, and then you get a lot of these small, and it's a bad name to say polycystic ovaries. It's a lot of small follicles, and so if you can get involved early to these patients and kind of quiet them and kind of get them back to a better flow, a wax and a wane, so to speak, then they can prevent a lot of the downstream effects in terms of infertility. The problem is that when they come through the door, the doctor says, oh, you're having trouble with your menstrual cycle, here's a birth control pill. Oh, you want to get pregnant, here's some IVF, or here's some medication to stimulate your ovaries to ovulate. But in between that, there's, like you said, a lot of women just don't like the hormones. And so, one of the, and so what I would do is I'm a voracious reader of the research products and research projects, and papers would come into my inbox, and I'd be reading everything I could about PCOS. And, every I would say every couple months or maybe even weeks, I would get an article about exercise, diet, nutrition, mental wellness, microbiome, and all of these things, and supplements. Okay, and so I started, really diving deep into it, and there are specific diets that work very well to improve a lot of those hormonal fluctuations. So much so that I work with a nutritionist. Her name is Lauren Allen, and she's phenomenal, and she'll tell her story as well. She had PCOS, or has PCOS, and like worked her way out of it by aggressive diet manipulation, and was able to conceive. Now she's pregnant again. Actually, she's happy to say, and so she's already on her second pregnancy. And so I work with her to counsel my patients on the proper diet. Now, one of the other things that we talk about as well is not just diet, but nutrition. Now, someone says, well, what's the difference between diet and nutrition? Diet and nutrition is very different, because nutrition, I like to say, diet is what you eat, nutrition is how you eat, with who you eat, where you eat, when you eat. A lot of times patients have toxic friends who unfortunately are having issues, that come out to me, go get a pizza with me, or ice cream, or a couple of beers at midnight. That's not going to help with your process. It may help your friendship, and I support it. I don't want you to abandon them, but maybe a better better way that you can make that nutrition. One of the big issues is on how you eat. Take, for example, and this has been very well studied and well documented, that let's take a normal meal, and you have a protein like chicken or turkey or even meat, rice and broccoli, or some high fiber vegetable. And let's say you eat the rice first, followed by the broccoli, followed by the protein. You're going to see a spike in your glucose and a spike in your insulin, okay? Because these high starchy vegetables will spike your insulin. Now, if you go and eat your fiber first, followed by the fatty meat, or some other high, or avocado, or some other, go around the cycle that way, and then get to the rice, you will see a much muted response in the insulin. And we know, and this is something that triggered my thinking, we know that insulin resistance is the cause of 70% of PCOS. And the reason we know that is that historically, when women had PCOS, they would get a drug called metformin. Back to our drug conversation, get metformin. Metformin is a medication for type 2 diabetes. Now, I'm telling you, I can't tell you how many conversations I had with patients, countless conversations, when I would write for them to take the metformin, and they look at me, they went to the pharmacist, and the pharmacist says, oh, this is for type 2, it's for diabetes. And they come back and they say, well, I don't have diabetes. So now I have a whole spiel. I say, you don't have diabetes, but ... This has been shown to improve ovulation, improve conception, improve, egg quality, improve. And then I started thinking, like, why is it that this type 2 diabetes is rampant? And also, I take a step back, patients who have PCOS and do conceive have a higher risk of gestational diabetes of pregnancy, and diabetes later on in life, type 2 diabetes later on in life. They also have a higher risk of endometrial cancers and heart disease, and there's a whole list of other things that they're at risk for. So it's very important to get that under control early. So I started thinking about all, if you go on to any pharmacy, nutraceuticals, there's a whole list of these supplements for type 2 diabetes to, sugar control, and they wouldn't sell them if they didn't work. So I did some research on type 2 diabetes and supplements, and then the aha moment was I started putting them together and offering my patients these supplements together. And sure enough, when they take it, they're starting to menstruate again, they're starting to ovulate again. And so, I went from, and I include this in my spiel now that I've kind of like gone away from the, oh, here's a drug. I start with a diet, I start with the exercise, diet, nutrition, and then the third circle is exercise. And as you just do a Google search in PubMed, which is like where all the repositories of the studies are, exercise and PCOS, you see there are specific studies that are good, for specific exercises that are good and the specific exercises that aren't good. Because we talked that 70%, 70+% of PCOS is insulin resistance. We also see that that there is a portion of adrenal and high inflammatory and stress-induced PCOS as well. And so this goes back to your conversation about your mom and her autoimmune disease and all the inflammation. So then you see that there's this exercise, and I have another exercise physiotherapist that I work with that's on my educational site, that she goes through specific exercises geared towards PCOS. So that actually helps as well. You know, then I have this big Venn diagram, and moving down from diet, nutrition, exercise. The next one is mental health. Why? Because that whole stress, you know, that spiral where you start more stressed, you start thinking, oh, I didn't ovulate, didn't conceive this month, and going abnormal bleeding, you kind of going down this whole thing, and it becomes like this never-ending conversation of just like going down that rabbit hole. So I tell my patients now, based on what I was talking about to you earlier and what we spoke about in the past, I said the best antidepressant and de-stressor and de-anxiety is going outside. Going outside, you know, God gave us the sun from sunrise to sunset, and it is the best medication out there. And so if you go out and get 20 minutes of sun, and I try to encourage the exercise on your skin, okay? On your skin every day, it activates vitamin D, melatonin, if you get the endorphins and the you know, all the excitement of all are considered antidepressants. And it's amazing that it's right here. You have it, I have it. In Massachusetts, I was in Boston for about 2 years, working in a pharmaceutical company there, and it does get a little dreary there sometimes in the in the winter and in the rainy days, but still wonderful. And hiking outside, and I always say, even if it's raining, go outside. Let the rain hit you, and that improves your mental health. And then I move down that circle, and in my Venn diagram, I get to the microbiome. Microbiome is the bacteria that lives in our bodies. That if you eat properly, and the antibiotics, if you need it, you need it. I don't want you to not take antibiotics if you need it, but this like prescription of antibiotics all the time does damage to our microbiome. And we know that there are certain microbiomes that are proactive, that they cause neurodegenerative diseases, cancers, inflammatory, and that's why I think your mom did so well on her diet and lifestyle modifications. That was just amazing. So I think that God bless, and she should continue to do well. But that's the key, was the microbiome in her case, is that she trains her microbiome to decrease the inflammation in her body. Autoimmune diseases such as MS and whatnot are and PCOS has a specific microbiome that we've seen. And then moving along my Venn diagram, I get to the supplements, which I'm very, very big on, because I know that it works, because I see that it works. This combination, this specific combination, has been shown to decrease insulin resistance, decreases cravings, decreases your appetite. Patients have lost weight on it, rectified their menstrual habits, conceived. And then lastly, and I don't want to ignore this because I am a doctor and I know that it's critical, that last bucket is drugs. I mean, sometimes patients need, to go through infertility treatments. Sometimes patients need to go on birth control pills, for irregular bleedings and protection and whatnot. I don't want to ignore that, but I want to take it in context. And you have to, because we're in life is in context, and some patients don't want to conceive; they just want to control their bleeding. So it's really important that you work carefully with your doctor, and your doctor's got to be open to these things. Once and you can tell with body language and interactions, once you start going down this path and talking about these things, and if they start like it becomes a challenge to to move forward with that. But certainly there's a lot of work that we can do. I did want to talk about your mom and the microbiome and the sun, and that's all part of my spiel, as I say.
But microbiome is something that I feel like it's a new buzzword in the last 5 to 10 years. It's probably been there. It's just coming into my sphere. And I really, and I try to pay attention to it, but there's so much to read and pay attention to. So I know that things like probiotics, yogurt is the one that comes to mind specifically, as far as adding something into your microbiome without an actual probiotic supplement. But what are some other
Right.
what are the things that affect the microbiome that we could potentially add or even take away from our diets?
Yeah. So processed foods and sugar and high glycemic sugar, because that basically feeds the microbiome, and you want to try to starve the bad microbiome and encourage the good ones. There are probiotic supplements that you can have, that you can take, a lot of the like sauerkraut, like things that have been aged, pickles, things that have a lot of that, sourdough bread, things that you generally think of it as on the healthier side, but any of the processed stuff is toxic. All that stuff gets broken down really, really quickly, and basically you absorb a ton of the sugars into your body, and that gets transmitted. But extra sugars that go to your gut get picked up by the bad bacteria. You kind of want to starve those bad bacteria out. And so that's what you're trying to do. So those are the things I would recommend right off the bat. And just remember, if you're looking for a binary event, if I do this, this will happen. If I do this, it's not going to happen. And you're not going to be satisfied. Okay. And that's critical to get, wrap your hands around. You have to do the healthy decisions, healthy lifestyles that are additive. They work together over a long period of time. And I think that's critical to know. So certainly the microbiome is a massive, piece in the puzzle. And again, it's part of my circle of my Venn diagram.
And like you said, it's not just one event. It's right. It's your nutrition, your diet, moving and exercise, and putting them all together. Right. And it's we had talked about this before, that it takes time. It's not a quick, and you have to be. I think many people come to me for physical therapy and they're like, just make me better, and I want to get back into doing whatever it is. Right. But it's a process, and I don't think that we as PTs address the nutrition end of it as far as how it affects inflammation and that enough. And maybe we can't. We need to have a little bit more resources, to really speak to it. But I think that plays inflammation plays a lot in how your whole body feels. If you're waking up feeling achy and stiff, right. or if you're bloated, and right. Nutrition will play into that, as well as exercise and fueling our body in a way that helps feed the good stuff as well. And it's time, and it takes, it's a lot of work.
Right. And so just on that note, in terms of we as humans, so to speak, we put a goal ahead of us, whether that be weight loss or feeling better, and we see that goal, and we know if we think that it's binary. Again, we think that if we put in the effort over time, we'll reach that. Okay. And so we put in the effort, we put in the time, and we end up here. We still, and we're like, oh my God, I haven't lost weight. I haven't felt better. I'm still bloated. And or in terms of physical therapy, we're just not making any progress. And you kind of coast. You don't realize it though. If you keep doing those things over time, eventually what happens is, you kind of hockey stick up, and then you want to reach your goal here, you overshoot your goal, and then all of a sudden now you have all these healthy lifestyles, and those are the things that you're looking for. And that's the better outcome from this. Not that you reached your goal. Your goal should not be the be all and end all. Your goal should be directional, meaning I want to go in this direction. How I get there, I got to do diet, exercise, PT, physical therapy, all these different things. And then, so I'm not losing weight over the first couple of days, first week, first month, first year. I don't care what it is, but as long as you're doing those, all of a sudden you'll find yourself looking back saying, wow, look what I accomplished and more. But what happens is the vast majority, give up before they reach anything, and they don't realize they're going to be overshooting it. And I like to call this James Clear in his book, Atomic Habits, called that the valley of tears, or valley of despair, or valley of failure. It's this valley where you're actually doing things. And people, I know people that have the best habits. They're always looking to see when they can get to the gym, because if they don't get to the gym, it's it becomes I don't say disaster, but it's really a challenge. So we we want to just encourage the good habits, encourage the diet, the exercise, the nutrition, and and that also helps with the mental health. And one other thing I want to talk about outside, especially as it relates to PCOS, I tell this to patients all the time. I say, whatever you eat, say you didn't eat well, go outside within the hour after you eat, and get out there and give yourself 20 to 30 minutes. And you can even be next to your desk and not outside of exercising, stretching, and just kind of working your skeletal muscles. Your skeletal muscles, which are your muscles of your body, are basically, they use the glucose that your body just ingested. Okay. You ingest food, no matter how it comes, and it gets into your stomach and it breaks it down, it gets into your bloodstream. And then the skeletal muscles will use that. And if you're just kind of sitting at your desk and on the computer, your skeletal muscles are not using it. And the body's like, oh, the insulin's like, okay, I'm going to drive these glucose molecules that are around your body somewhere. I need to store them. Either I'm going to use them now with the skeletal muscles, or I'm going to store them in the liver and in the fat cells. Okay. And that's what happens. So in the hour after you eat, as things start, like, I don't know. Our moms used to say, "Don't swim." The hour after you eat, you drown. I don't want to. I don't want to conflict my mother or conflict my grandmother. I just want to say, go outside and do something physical, even if it's standing by your desk up and down for 20 minutes. That'll be enough to change your habits for the good and see some positive outcomes. But again, not overnight. Not in the snap of a finger, it's time. I had a professor of medical school who used to, trained us, was a mentor. He used to call it a tincture of time. He used to call it a tincture of iodine. Everyone got a tincture of iodine, but this was a tincture of time.
I think I just read I don't think it was a scholarly article at all, but that you can even just make a change with 11 minutes at a time, like doing something that you're moving.
Exactly.
That doesn't have to be a big, I'm like, I don't have an hour, so I can't go do my workout. Which is my mindset. But like even that little bit of time and putting it in through the day, changing your mechanics through the day, I think can make a big difference on everything. So
I think there's definitely, the lifestyle changes that we can do and that's within our grasp. Are attainable, the regular physical activity, healthy diet patterns, avoiding tobacco products. I think that's a tremendous amount in terms of prevention, and it's vital, especially, for our metabolic disorders and whatnot. I think overall focusing on, well-being and mental health, those are not exactly an immediate fix, but it's an important step. And you have to, to living a more fulfilling life. And that's what we're trying to do.
Right. My big question is, how do we, because you and I, this is what we're passionate about, is helping people to find these, and it's not alternative ways. It's something that we all do. We all eat, we all, move at some point. But to embrace the things that are at our fingertips that are relatively easily accessible, versus jumping at that quick fix, whether it's a layperson going to the doctor or the doctor. And I understand this is, I understand, you have 5 minutes with somebody and you have 5 other people waiting at the same 5 minutes. It's hard, to sit and listen and have a conversation and be like, let's put these pieces together. So
I think I'll add, there's a lot of noise out there, right? Right now, if you go on Instagram, if you go on all these the top 5 foods to eat for this, top 10 thing to do for that, the top exercises for this, and top this, and then you're writing everything down. Like I could just see a skit of someone, putting a disease into Instagram or TikTok, and then getting, these influencers and just doing every single thing that those persons said. You'd implode. It would be, I think you have to just find either someone, we have an educational site that I go through everything we just kind of went through and kind of the history for PCOS, and the nutritionist is on our educational site, and our exercise physio, and it's right now it's a free content. We sell our supplement that kind of goes along with it. But again, it's not just a supplement. But I think what, and we're coming on the new year and everyone has these New Year resolutions, but I think that you can't put your goals either too lofty or too distant or too esoteric. I think your goal should, just like you said, is just to put one foot ahead of another. You don't have to be motivated to run a marathon or 10K or an hour. Just be motivated to get outside the door and get the sun on your head for 10 minutes or 2 minutes. Once you're outside, then, right, then that person's going to be, is going to lead a better 10 minutes, 15 minutes, 30 minutes. They're going to feel better about themselves. So you gotta start stringing some wins together, Right.
And all of that also feeds into getting, it stimulates melatonin. And like, if you can do that short amount of time, that in a way that will help you sleep better. So if you get that earlier in the day and you're I
didn't mention that as well.
Help the sleep factor and the recovery.
Exactly. 100%. I couldn't agree with you more. It's been well proven that healthy sleep patterns really improve the outcomes as well of life in general. But how do you get healthy sleep patterns? We know that if you're outside in the sun during the day and you're exercising, you are going to be improving your mental health. We know that mental health disorders have a higher rate of insomnia and sleep disorders. So and specifically also in PCOS, we have a higher rate of mental health disorders as well, including anxiety and depression. And so what does one lead to the other? Meaning, does a sleep disorder impact your anxiety and depression that causes PCOS, or vice versa? Right. So exercising outside, improving that insulin resistance, can really help regulate your hormones and your pathways. And so, I can't stress enough that improving your sleep habits will improve your body's hormonal balance, your body's protective properties, and just combat not all the ills, but really help. And it's part of the it's part of the big picture, so to speak. So yeah, that's a really good point about the sleep habits, because it's part and parcel.
I want to touch briefly on hormone changes, and how that kind of leads into, as you age and getting into perimenopause, menopause, and beyond. Is this something that I know the answer to this question, but is this something that we pay attention to when we're younger and dealing with our period issues and all that, or and how does that, if you haven't paid attention to it when you were younger, can you pay attention to it now when you see changes after?
So right. So as a woman, I used to say, as a woman transitions into you can't say that anymore. I don't even know what to say anymore. But as a woman goes from a premenopausal to perimenopausal to postmenopausal, menopause is a moment in time. It's Latin for menopause, bleeding, stopping of bleeding. Okay, that's a moment in time when her last period was, then followed by 6 months of no bleeding, and you look back and say that was the menopause. The 3 to 5 years before, and the 3 to 5 years after is that perimenopause, where there's a lot of hormonal fluctuations. And certainly women who are prone to the hormonal fluctuations tend to continue that throughout their life, and so certainly there is room to say, well, those fluctuations that have been caused, the insomnia, the mood swings, the night sweats, the anxiety, the irritability, all of the above, some of the above, none of the above. Everyone is very individual. And it's usually from, a lifelong of hormonal fluctuations that are now being exacerbated on a day-to-day basis. So certainly when we're talking about, whether it be mental health or sleep patterns, again, this isn't rocket science, but exercise, nutrition, microbiome, getting the sun on your body, activating your vitamin D. I can't tell you how many patients I see on a daily basis that vitamin Ds are through the floor. And I'll just take a pill. I'm like, You got the pill. It's right outside.
Yeah.
It's the biggest yellow pill you could ever see. But if you don't do it, you're not gonna. It's not gonna do well for you. And also you have to remember all these interventions that can help the maturing, woman also helps the maturing man go through their andropause, so to speak. And men have felt left out that they didn't go through menopause. They created this thing called andropause. I'm not going to go there, but certainly men are affected as well. And all those things that we just talked about are all effective. Will they make all and there are different supplements that you can add that are on the healthy side, that aren't hormones, that aren't related to all these negative connotations of hormone replacement therapy. And then lastly, back to the last circle of medications. If someone is feeling that they're not functioning because of these symptoms of menopause, there are medications that you should speak to your doctor about. That can be helpful. You use it for the shortest amount of time at the minimal amount of dose, but you have to be open to that conversation, and you can't be swayed by what you read in the news or you see. It's got to be individualized. I always talk about this with patients. I say, I don't care about the other 8 billion people in this world. I only care about you because you're the one sitting in my office right now. And I care about your functioning. Well, I heard this, I heard that, I heard that. Stop with the nonsense. Stop with the Dr. Google. We need to take care of you. And am I giving you this hormone for the rest of your life? No, I'm giving it to you for a few months at the minimal dose to see if this is effective and making you live a better, productive life for you and those around you. And the best thing to do is have a good conversation, an in-depth conversation with your your care provider.
That's great information, and I think that goes across the board for a lot of. I think starting that with as the entryway and the baseline can make huge changes for a lot of different medical issues or medical stuff.
And I think your mom is a perfect example of it, who used an autoimmune disorder, and she really, and again, someone's going to say, well, she didn't have a severe disease or whatever. Let's not right. Let's not judge. She's living her best life, period, and that's it. She had a tough diagnosis, and
she had 2 other kids after, and was told not. She's stubborn too, so there's that.
God bless her.
Yeah. Do you? So I know you said you have a lot of free resources on your website. I'll definitely put that in the show notes as to where the website is so they can find you. Did I hear that you also have an online course or something that?
So I have 2 sites. One is on my the site where we have our combinations called inositol plus. Basically, inositol is the main ingredient to help PCOS, but then the plus is all these other ingredients targeting type 2 diabetes and insulin resistance. Basically, so Provation Life, OVA, the name is OVA as an egg. Ovation is as a standing ovation, and Provation. So it's provationlife.com. That'll show you the all the science behind this combination. And education.provationlife.com is where I have all my modules on specifically for PCOS. I have all the links. I have the nutritionist with giving her, and dietitian giving her her story, her narrative, and helpful diet recommendations. And I have the exercise therapist with her resources for which exercises are good, and she gives some examples of some, and it's a really it's a great resource. Right now, like I said, it's free. There's no upsells. I just felt like the medical community has kind of not abandoned, but kind of just has really just gotten away from like taking care of patients. Here's a drug, here's this, come back if it's good, come back if it's not good, and we'll give you another drug. And I feel like there's just so much more to empower yourself. And I felt also, unfortunately, we live in a world of Instagram and TikTok, and I kind of want to guide, not patients away from that, because there is some information, but give them some real, meat on the bone, so to speak, something that's really meaningful.
Yeah, I think I certainly post my stuff on Instagram, and TikTok is more for fun for me. But it's you want to keep the information short, so you're only getting snippets of information, whether that be an exercise or nutrition or whatever. It's meant for entertainment, so it's
I'm not against it. Trust me, I'm not against it. I just want to you have to weather the information you're getting and distill it into something that's meaningful for you. And you can't do that in such a quick, you can say, hey, what about this? What about that? Let me look into these studies. But now with all this insanity in terms of false information that's out there, don't get your medical information from Instagram or TikTok. Get it from your doctor. If you can't find a doctor that you like, reach out to me. I'm available through the various sites, and just come out with a meaningful, actionable plan. Because nothing and sustainable. That's what's also most important. Sustainable, no matter where you are in life. Whether you're trying to conceive, whether you're trying not to conceive, whether you're postmenopausal, perimenopausal, there are actionable plans that you can really make you live your most, fulfilled life, whatever that may be, and wherever you might want to go. But it's not easy, and it takes time and effort. And I think that's those are the messages.
That's the main thing, right? Is there any other information that we haven't talked about that you want to get out that you think is important for people to know?
Yeah, I think
a loaded question. But
I think there's a ton of other stuff that we can talk about, but I think that people need to, once they go to their doctor, if they get bad information from a doctor, or information that's so dramatic, oh, you're infertile. Like, I hear that a lot with patients with PCOS. They say, oh, you're never gonna have babies, and they come into my office crying, and I kind of have to undo a lot of damage that's been done, or stuff that they get on the internet. I think people need to just kind of take a lot of deep breaths and kind of internalize, but also take a lot of the information and adapt it to them. Try to get to where it's with them, and I'm frustrated by a lot of my colleagues. Not that they have an inability, because right now we're being pressed. We're being pressed to succeed and make a living. And so we're limited with our time. So let's just take a lot of deep breaths, and let's just try to live our best life and get to that sun, because the sun, like you said, activates the vitamin D and melatonin and just clears our head. I get up at 6:15 to ride a bike outside in the woods and in the mountains. I try to do it 3 times a week. Happy with 2. Strive for 3, and Monday, Wednesday, and Fridays. And it's like a tonic. It's like a drug. It's as good as it gets. And so get out there. If you wanted more information, you'll post it, and we'll hopefully we'll help people live their best, most fulfilled life.
Awesome. That's great. And that is a perfect way to segue into my closing statements of, so I always say, as we end thank you for listening. Don't forget, when in doubt, breathe it out. And that's key to what Dr. Weiss just said. And take it one step at a time. All progress is, it's not linear. It goes on that Venn diagram, and it's a gradual progression, one step forward. Take it slow and easy. Thanks for joining us today, Dr. Weiss. I really appreciate this. It was a great conversation, very informative for me. I wish I had this conversation 15 years ago. But it's, thank you. I think you have a great message to spread, and I hope, we keep talking and getting this information out there. So thank you very much.
Thank you for having me. And again, I think these platforms are useful. You have your followers, you have your people that listen to you and trust you, and you have you have the best message. The message is keep making progress and keep breathing.
Exactly. All right, everybody, have a great day, and we will see you next time.
Thanks for listening to this episode of Move Better with a Cheer PT. If you enjoyed the episode, please share it so more people can learn how to embrace healthy and fun movement. If you'd like to work with me on your fitness journey to stay strong and healthy, you can find me at the link listed below. That's where you'll find all my free guides and access to all my social media channels, as well as to book an appointment for a free discovery call to discuss your goals. Thanks for being part of our cheer team. Remember to live life without deductions and with extraordinary cheer.